afternoon, good evening, wherever you would be watching me from. Today, I'm just here to throw some light on non-steroidal anti-inflammatory drugs. I released a video recently on peptic ulcer, and I read a couple of comments that prompted me to talk a little bit more about non-steroidal anti-inflammatory drugs. So, the comments were about the fact that these people, one of them said she suffered peptic ulcer some years back really badly. And what happened was she didn't really know much about non-steroidal anti-inflammatory drugs. The other one said she suffered peptic ulcer. And I think what happened was that she took somebody else's medication. And I wanted to address both comments. So the first thing I want to talk about is what are non-steroidal anti-inflammatory drugs? Non-steroidal anti-inflammatory drugs are drugs that are used for the treatment of inflammation, they are used for the treatment of fever, and they are used for the treatment of pain. Examples include ibuprofen, naproxen, dicoofenac, indomethacin, celecoxib, which is less commonly prescribed, and mefenamic acid. So there are different strengths of these drugs. For example, ibuprofen, you can get a 200 milligram, a 400 milligram, and 600 milligrams. Sometimes you can even get an 800 milligram, and they come in different brands. You can get brands like Advil when you live in America. In the UK, the brand that you can get is Brufen. With naproxen, you can get a 250 milligram or a 500 milligram. And the strength that is prescribed for you is based on the intensity of whatever is wrong with you. So the different strengths can be used for different conditions. These drugs, that is the non-steroidal anti-inflammatory drugs, are given for the treatment of, for example, period pain. They are used for the treatment of arthritic pain. They're used for the treatment of headaches, for some inflammation, for sprains and strains. And they're very effective. Yeah, they're really effective. Some are stronger than others. So based on the type of pain and what your doctor would prescribe for you. So it's not every pain that when you're suffering, you would get a celecoxib prescribed. The doctor would assess the pain and assess you, the person, as a whole to find out if the anti-inflammatory that they are going to be prescribing will be suitable for you. So it's not advisable that when you're on ibuprofen and somebody is prescribed naproxen, you take that person's naproxen because you've had ibuprofen before. No, you need to make sure that it's suitable for you. So it calls for you always speaking to a healthcare professional to make sure that whatever medication you're taking is suitable for you. Some of these drugs can be even bought over the counter. For example, ibuprofen. You can get 200 milligram ibuprofen over the counter to buy, and you can get a 400 milligram behind the counter where you'll be assessed to find out whether that strength is suitable for you, because it's not all these anti-inflammatories that can be taken by everybody. You have to be assessed first. So one of the main things about these medications is that they need to be taken with food, because one of the commonest side effects is stomach ulcer. When you don't take these medications with food, they can cause an irritation of the tummy and they can cause stomach ulcer. Some people will take a single dose and they will develop stomach ulcer. Some people will take it for a longer period at higher doses before they would develop stomach ulcer. So it is appropriate that you make sure that the medication is suitable for you and you take it with food. Some common side effects of these medications are nausea, vomiting, and as I said earlier on, peptic ulcer. There can also be indigestion, and stomach pain. So it means that you need to make sure that this medication is yours. And if you are suffering any side effects that you are not able to cope with, report back to whoever prescribed the medication for you so that they can change it for you. Also, some rare side effects are heart attacks, stroke, and kidney failure. So it is essential that these drugs are used with caution. This is very important. It's not everyone who can take these medication. There are some people who can take it, and there are a group of people too who cannot take it. For example, if you're pregnant and you're trying for a baby, you can take non-steroidal anti-inflammatory drugs. If you're breastfeeding, you can take non-steroidal anti-inflammatory drugs. If you suffer from asthma, you can take it. And if you have peptic ulcer, you can take it. Also, if you are over 65, you need to be very careful when it comes to non-steroidal anti-inflammatory drugs. And if you have a heart problem, it is very advisable that you refrain from taking these unless it is prescribed by your doctor. So, before you take any medication, let me just address this. Before you take any medication, make sure that medication is yours. Don't go taking people's medication. When you're suffering from a headache, you go and take somebody else's ibuprofen or somebody else's naproxen or somebody else's dicoofenac. It might not be the drug that is suitable for you. It is very important that we are all cautious of whatever medication we take. Take medication only if it has been prescribed for you. For example, when you go to the pharmacy and report to the pharmacist that you have a headache, your pharmacist will ask you a few questions. They would ask you if you are on any medication. They would ask you if you suffer from any other condition or you have any underlying condition. They would ask you if you've taken any medication at all before coming into the pharmacy. And with that in mind, they would also ask if the medication is yours. And with your age and everything, they can assess and find out what medication will be suitable for you. So that medication that is prescribed at that point is for you. It's not for anybody else. So make sure you don't go in taking people's medication. The medication for your mom or your dad or your sister or your brother or your friend might not be suitable for you. So let's all be cautious, take note of this, and make sure we don't go taking people's medication. So briefly, this is all I have for you this morning. I hope this is helpful, and please share this video with your family and friends. Put your questions and your comments in the comment section. If you have any topic or anything about any medication or condition that you want me to talk about, put it in the comment section and I would take it up, research into it, and talk about it. I hope to see you soon in my next one. Thank you so much for your time. Thanks for staying with me up to this point, and I hope to see you soon in the next one. Bye for now, and have a good weekend.